Hello everyone, I'm Dr. Timothy Keenan. Today I'd like to show you the best way to heal persistent jaw pain yourself. Place your hand flat against your head, make a fist with your other hand and press your thumb into the jaw just below your ear. Open your mouth slightly, then slowly slide your thumb upwards across the painful articulation. Repeat the procedure 10 times, concentrating your efforts on the most painful region and adding pressure as the tissues warm up. Do this 3 times a day. This is the temporomandibular joint capsule. If it hurts yet feels good at the same time, you're doing the right thing. It's that simple. Try it for a week. If you feel improvement, continue treating yourself at the same intensity until you're perfectly healed. If you can open your mouth further and with less pain, it's proof that you're healing and you should congratulate yourself. If you treat yourself as I've described, you should be completely healed in 1 to 3 weeks, depending on the severity of your condition. When you start, it's normal to have sensitive skin for 3 to 4 days as your body eliminates stored up toxins. If your skin is too dry, add several drops of hand cream. Never apply heat, since heat increases inflammation. In order to accelerate healing, avoid hard foods and chewing gum, and always chew with both sides of your mouth. Once healed, if ever you feel the pain coming back, treat it immediately before it gets worse. Finally, in an effort to clear up the confusion surrounding the real cause of jaw pain, if you heal yourself using my method, it's scientific proof that your jaw pain was caused exclusively by contracted soft tissues, since that's all my method corrects. This means that even if you can see osteoarthritis, what most people call arthritis, fibromyalgia, osteoporosis, spinal stenosis, scoliosis, misaligned vertebrae, subluxations, pinched nerves, a short leg or degenerated, slipped, thinned, bulging or herniated discs on your X-rays, CT scans, or MRIs, they have absolutely nothing to do with your pain, so you can ignore them. Only 10% of jaw pain is caused by things other than contracted soft tissues, muscles, ligaments, tendons, and fascia, so you have a 90% chance of healing yourself when you use my method correctly. That's all you need to heal pain yourself. If you have any questions, feel free to write me. Bye for now and happy healing.